Good afternoon. This is Ronald Giffler, your FMA president. Welcome to this follow-up town hall style webinar on practice survival resources during the COVID-19 epidemic. Americans continue to be locked down in their homes and doctors continue to fight on the front lines. America's healthcare system is facing a long-term financial crisis that threatens our ability to provide care for years to come. Patient volumes have dropped dramatically. Officials have ordered physicians to cancel any procedure that can be put on hold. Although these steps are crucial to stopping the spread of the deadly virus, they are creating a crisis for doctors. When patients aren't coming through the door, doctors are losing the revenue that keeps them in business. The volume drop is here. The revenue drop is just about upon us. If our practices cannot remain financially viable, reduced access to healthcare will hurt patients all across the country. Last month, Congress passed the CARE Act, a multifaceted relief bill of more than $2 trillion. More aid may be on the way, both legislative and regulatory. The mission of the Florida Medical Association is to help physicians practice medicine. To this end, we have assembled this webinar to provide guidance on the resources available to keep us afloat in these challenging times. Our first speakers will be from Carr, and Ingram. This is an accounting and consulting firm ranked by Accounting Today as among the top 20 CPA firms in the country. Founded in 1997, Carr is present in 10 states throughout the Southeast, with 22 offices located in the state of Florida. Michael Carter is a partner in Tallahassee and handles the audit and tax work for the Florida Medical Association. David White is a tax partner in Tallahassee and actively works with numerous professional associations. Brian Hall is the firm's leading healthcare industry partner and is a primary resource for the impact of the CARES Act. So with that, I will introduce Mr. Carter to start the meeting going. Thank you.
Okay, thank you, Dr. Giffler. I appreciate the kind words. We have about 10 minutes to discuss the assistance and incentives under the CARES Act. And so mainly my goal is to provide you with an overview and just give you some information so that if you see something that pertains to you, you have the ability to ask questions later or refer to the links that I have here within our website. There's so much information out there that's been changing daily that we could probably talk about this for an hour or more. So this is intended just to be a quick overview. The first slide that I have here are the summary of some of the available options under the CARES Act. I'm going to speak about the Payroll Protection Program because that's the one that's the hot button that's been in the news lately. And then I'm going to turn it over to David White, who can handle some of the more specific tax deferrals and credits that are available. This chart that I have on the screen right now is a summary of the programs that are available and the amounts that are available to you. But we do have a more detailed chart at the link there provided on our website. It's about 3 pages long that gives you information about amounts, eligibility, how to use the credit, that type of thing. It's a really good informative schedule. As far as the Paycheck Protection Program, if you've already applied for it and gotten it, there is a forgiveness policy for the next 8 weeks once you receive the funds. Beyond that, whatever doesn't get forgiven will be a loan, and these are the terms that the loan will be set up for. I just put that on there. I'm sure people are more concerned about the forgiveness piece of that right now, but I do want to put this up there just so that you are aware of the terms. Recently, the U.S. Treasury released guidelines related to self-employed individuals. There was a lot of conversation about how do you calculate the amount of the proceeds and that type of information, because most of the stuff that was available related to small businesses. What it boils down to for the self-employed individuals it's based on your 2019 Schedule C from your 1040. Whatever the net profit is, it would be limited to $100,000. And since the assistance is based on an 8-week period, it would be basically 8/52 of that net profit amount under Schedule C, limited to $100,000. We do have a pretty detailed article on our website again about the self-employed program, just to give you some additional information on how to calculate that amount and the types of expenses that would be available for the forgiveness piece of it. For the forgiveness, once your loan is funded, the loan origination date kind of starts the period. It's an 8-week covered period, and any amounts that are used for payroll costs, interest on a mortgage related to the business, rent costs related to the business, utility costs related to the business can be eligible for forgiveness. There's some specifics out there on what constitutes payroll, whether it can include health insurance benefits, retirement, those types of things. But those guidelines are very, very broad. We get so many questions about very, very specific details on, such as retirement. What about profit sharing? What about bonuses? Those guidelines aren't readily available yet, but over the course of the next 8 weeks, I'm sure more details will come. Some of the more, I guess, topical items that people are asking about, your non-payroll costs are limited to 25%. The primary reason for this Paycheck Protection Program is to retain those full-time employees, keep the workforce going while businesses are closed or damaged. So the primary focus is going to be on your payroll, which would be 75% of the total forgiveness amount. Another question that we get pretty frequently is, what about the taxability of the amount that's forgiven? And there has been legislation out there, details that suggest that the forgiven amounts are not taxable. So I think that's an important piece of it as well. So for all of the forgiveness that you do get, once that calculation is made about what the payroll costs are and the amounts that are eligible for forgiveness, there will be a reduction of that forgiveness amount. The goal of this is to retain your employees and your wages paid throughout that 8-week period. So at the end of the 8-week period, your forgiveness amount will be reduced by the number of employees that you weren't able to retain. And here's some information here about calculating it. A lot of the details are absent right now about how do you come up with the full-time employees. Is it an average? Is it as of a certain date? And those things just aren't available right now, but we expect them to come out soon. As well, there's a reduction for any individuals whose compensation is reduced significantly over that period. So if it's reduced by more than 25%, there could be more reduction in that forgiveness amount. Now I'm going to turn the presentation over to David White to kind of go over some of the deferrals and credits that are available to you, and I'll stand by and watch on the sidelines for a moment.
Sure, thank you, Michael. And so what I want to talk about right now is the benefit of the payroll tax deferral, which is where employers can defer up to 6.2% of their wages that they pay to employees up to the Social Security cap of $137,000. That's for payroll from March 27th, 2020 through the end of the year 2020. And you can then defer that payroll, the Social Security tax, through the end of 2021, 50%, and then the remaining 50% only has to be paid then by the end of 2021. And so this cannot be used with the payroll protection plan. You can't really double dip, but it does allow for people that want to prioritize cash flow. They can, you can defer Social Security taxes on at least the employer portion of that. So let's maybe go on to the next slide. The employee retention credit. This is if you are an affected employer and you are retaining your employees. This is actually very similar to with other disaster areas, such as with the California wildfires, with the Florida hurricanes that we've had. There has been the spirit of, if you retain employees, you can get some kind of a tax credit for it. And so in this case, you can get up to $5,000 per employee if your business was fully or partially suspended. In this case, gross receipts declining by 50%. Or more, and then you can get up to $5,000 of essentially what you pay that employee through the course of the remainder of the year. That can actually be fronted and advanced through a reduction in payroll taxes that you pay. So you don't have to actually wait until the end of the year to get that. You can actually get that in the current year that you're actually employing and retaining this employee. Regarding emergency paid sick leave, can be paid with the payroll protection plan and employee retention credits, but not used for the same period. Again, one of the common themes is you can't really double dip as far as any of these tax benefits are concerned. Must meet one of the 6 sick leave criteria. And it's up to 5110 or $2,000 per employee. And of course, it's limited to 80 hours of pay per qualifying employee through the end of the year. And then it also is refunded through the payroll tax credit or streamlined claim form. There are one of the main themes is that there are ways to get the cash flow benefit to the employer in advance of some kind of a quarterly or annual filing form. There are ways to kind of calculate that and retain that in advance of actually having to part with that cash. So that's something that, as Michael mentioned, as more guidance comes out, that is something that we're calculating and helping clients with arriving at how much cash they actually have to part with versus how much cash they actually have to pay to the government. But the employee retention credit, the payroll tax deferral, and the emergency paid sick leave credit is something that is basically allowing for employers to not have to part with as much cash as they normally would, which allows for some kind of a silver lining here and some kind of a benefit from a payroll standpoint. And I think that's actually all the high-level things that we wanted to hit. Michael, did you want to talk about, or Brian, talk about any Medicare topics at all?
Brian, are you on the line? I'd want to give you an opportunity to speak specifically to the healthcare industry if you're there.
I'm here, and I think we'll, given that our time is almost up here, I think we'll probably address specific questions at the end. But really, there's a couple of things. One is that there's the HHS stimulus that everyone should have got, and I know we'll have some question period at the end. There's been an allotment of $100 billion in the CARES Act. $30 billion has been funneled through at this point, simply based pro rata on your fee-for-service billing from last year. And then the Medicare Accelerated Payments Program is the other big win. At this point, you can ask for, physicians will be able to ask for 3 months of accelerated payments in advance. And then that's essentially an interest-free prepayment of future services that'll have to be prepaid via remit withholdings. Don't want to monopolize all the time here, but that's kind of a very high-level summary of the CARES Act, and be glad to take any questions when the other presentations are over about the specifics of it.
Thank you very much. We'll hold our questions all for the end so that our speakers will all get to make their presentations. Our next presenter is Erika Long. For about a year or more now, the FMA has had Washington lobbyists, and we will get a DC update. Erika Long is the principal and founding partner of the Anway Long Group, a boutique firm specializing in translating healthcare policy and government relations for life sciences, payer and provider clients, and connecting business strategies to the policy and government affairs landscapes. Ms. Long has over 15 years of healthcare and legislative experience at the federal level and has served as senior healthcare investigator for Ranking Member Chuck Grassley on the Senate Judiciary Committee, as well as his FDA policy advisor. She's also served on the professional staff for the Health, Energy, and Commerce Committee and Oversight and Investigations. The combination of federal and corporate healthcare experience has given Ms. Long expertise and insights into all aspects of healthcare and related legislative issues. Ms. Long has a BA from Florida State University in Political Science and International Relations, and will now give us a DC update, what's going on now and what may be happening in the months ahead. Go ahead. Thank you.
Thanks, Dr. Gipler. So, hi, everyone. Thanks for allowing me the opportunity to tell you what's going on in DC. It's a little bit of a mess these days, as you can imagine. So both the House and the Senate are officially in recess until May 4th. The tax guys that were on earlier did a great job of distilling what was in the CARES Act on a tax perspective. And we were hopeful, I should say Republicans were hopeful that we were going to pass another bump up of the PPP program by the end of this week. That unfortunately doesn't look to be the case, as Speaker Pelosi and the Democratic leader Schumer are digging in their feet on adding additional provisions to that. Many people are calling that a phase 3.5 or a phase 3 2.0. It doesn't really matter what you call it, but the fact remains that at the end of this week, as of yesterday, the funding has run out for the PPP program for small businesses. So that's really unfortunate. I think members from both sides of the aisle know what they need to do in order to quickly fund this, but they're at a standstill. So negotiations will go into the weekend. And I'm hopeful that by the early part of next week, the House and the Senate will be able to come together with the White House, and we'll be able to pass a bump up of just a clean PPP program. So that will put additional dollars into those small business hands. And if not, then I think that you'll wait and see until May 4th when Congress comes back in session. I don't really know how that's going to be addressed, given that a lot of states are still in quarantine and lockdown mode until May 15th. I know that the state of Washington and the state of New York, I currently live in Virginia, and we're on lockdown until June 10th. So how members will get back to the district to vote is still yet to be seen, and that does play a critical role and getting these bills across the finish line. So there is just a sort of strategic method on how all of this is going to get passed. The past couple of bills, CARES included, was passed by UC. And so not all of the members needed to be present in town to get that over the finish line. So I know that you guys care a lot about the remainder of the $70 billion and the $100 slush fund for providers. And so let me just walk through what I think Congress is going to do. I think that in the very near future, you will see a true up, and I think that that could happen as soon as today or possibly tomorrow. And that will be a true up. So the first tranche of the $30 billion was tied to your Medicare fee-for-service rate. So this second tranche will take into account your different payer mixes: private pay, MA pay, Medicaid pay. Then on top of that, so all of these will be divided. Then the second division money will go towards hotspots. So think of like major cities with higher rates of confirmed coronavirus cases. So think like New York, Louisiana, Washington State. it's interesting because hotspot isn't legislatively defined, and I don't know that they're going to define that. So it will be up to the White House and HHS on how that money gets dispersed in that hotspot definition. And then on top of that, you'll see a staunch of that money of the $70 billion going to rural areas, and they also haven't defined what rural means either. And then a portion of that will go towards paying the cost of treating the uninsured associated specifically with COVID-19. And that portion will be less than 10 billion of the 70 billion. So that's 4 buckets to be divided of the remaining 70 billion of the 100 billion. So just so we're clear on that. If you have questions about it, you can ask later. And the question will remain, what happens next? A lot of people are already focused on phase 4 and phase 5 of COVID response. And what Republicans certainly are focused on right now is seeing where the dust settles. So we want to get the $100 billion out the door. They want to see where the holes are, not only in the $100 billion slush fund, but also through the other programs that were funded. I mean, the $2 trillion out the door, that's one of the biggest bills that we've ever seen before. And so, for example, BARDA, I've been working with BARDA for a long time, and their biggest budget that I've ever seen is $3 billion, and they just got $27 billion in CARES. So that's a lot of money that needs to get out the door and to manufacturers and to providers and to insurance companies and to hospitals. And so I think legislators want to see where the dust settles before immediately jumping into a later phase 4 and phase 5 bill. A couple of weeks ago, there was a lot of talk about passing an infrastructure bill to get the economy stimulated again. And I think Pelosi and Republicans alike, including the White House, are in favor of that. The issue is, when you're talking about an infrastructure package, you need to know where to put those dollars, and members want a really heavy say in those infrastructure packages, because a lot of those reforms and projects will be happening in their districts and at the state and local level. And there's a fundamental strategic, members are not in DC to negotiate these things and to vote out these packages. So that's sort of been pushed to a later date. And I would say to the end of, towards the end of summer, we won't see that big infrastructure package happening until the end of summer. If anyone asks me what they're including or what's being negotiated in phase 4 and phase 5, it's entirely too early to tell. And there are a lot of members want a lot of different competing priorities that aren't necessarily associated with COVID-19. And they will get their bite of the apple in a phase 4 and a phase 5 package later down the road. And this actually brings me to my next point, because one of those things is something that the FMA has spent a tremendous amount of manpower on and interest in, and that's surprise medical billing. And I know this is a hot topic for all of you, but there are 4 members of Congress, 2 on the House side, 2 on the Senate side, that are making it their mission to include in the next phase, whether that's phase 4 or phase 5. So you have the chairman and the ranking member of the Energy and Commerce Committee, Frank Pallone is the chairman, Greg Walden from Oregon is the ranking member. And together with the Senate Help members, Alexander and Murray, they are really pushing their surprise medical billing. Now, if you remember, back before COVID hit, we were very successful in our surprise medical billing initiative and efforts. And when we left that, what does it mean to pass their version of the bill? Ed and Labor had passed their version of the bill, and the Speaker of the House and the minority leader, Kevin McCarthy, had gotten together and said, we want your committees, the 3 committees in the House, to get together and come up with a compromise piece of legislation. Prior to COVID-19 hitting, they were making good progress. That has all completely stalled. Those committees have not talked about surprise medical billing and that compromise in quite some time. So I can't tell you at this point what sort of compromise would even be included in a phase 4 or phase 5 package, but I can tell you that those members are actively looking to include that in the next tranche of COVID-19 response efforts. Now, this all hinges on whether or not I just lost my train of thought. The CHC, Community Health Centers, is funded. Because surprise medical billing, as we know, was always a budget gimmick. It was always needed to pay for something else. And in this case, it's the community health centers. So if community health center reauthorization, which is beloved by Democrats and Republicans alike, it's a very, very, very important program to many members. Community health centers provide a lot of care, especially to the uninsured, which means more now than ever, probably. So if community health centers receives a reauthorization in the next package, you can almost guarantee that surprise medical billing will be included, because they will need the savings from surprise medical billing to pay for community health center reauthorization. So that's sort of where the current state of affairs is with respect to what I know FMA cares about. So I think I've covered everything, Jared, from your perspective, but tell me if I've missed something.
No, I think that was a phenomenal overview from my perspective. Thank you so much for taking the time to give that.
Yep.
Well, next we will introduce again Jared Fowler. He's Director of Healthcare Policy Innovation at the Florida Medical Association. And his areas of expertise include healthcare delivery, payment modalities, managed care, and health information technology. He has been tirelessly going through these hundreds and hundreds of pages of legislation and regulation, trying to summarize and make some sense of it for us. And so, once again, I'd like Jared to give us an update, a presentation. And I'd just like to mention, although he's not scheduled to make a formal presentation, when we come up for our question and answer period, we will have available on the line as well our General Counsel, Jeff Scott, for any legal questions as well. So Jared, go ahead.
Hey, thank you so much, Dr. Giffler, and thank you so much for everybody that's on today. So there are a few things that I want to go ahead and talk about. The first is something that was already mentioned by CRI, and that is, as many of you are aware, HHS has began to disperse the first $30 billion from its $100 billion in provider relief that was allocated under the CARES Act. These came out to right about 6.2% of 2019 Medicare reimbursements for both Part A and Part B providers, so physicians included. And really, HHS offered these as grants that don't have to be repaid so long as the providers receiving the funds agree to certain terms and conditions. Now, I'm not going to go into every aspect of this because we covered it last week on our webinar, and we have a pretty solid guide on our website that goes into the details. And of course, we have time for questions at the end. But I do want to give you some updates on this program that I think are kind of important. So since last Friday, HHS has offered some additional clarity around some of the policy details regarding this program that I want to briefly mention. The big thing that they have done is clarified eligibility a little bit. So if you go to the HHS website now and you look under the who is eligible for the initial $30 billion bullet of their webpage concerning these funds, they clarify, who exactly, may keep the funds
as far as treating physicians are concerned. As you may recall, last week when HHS released its guidance, there was some confusion over whether or not physicians had to be treating patients with COVID-19 in order to receive these funds. Now, of course, that would limit their availability quite a bit. The terms and conditions stated that in order to be eligible, you had to provide on or after January 31st, 2020, diagnosis, treatment, or care for individuals with possible or actual cases of COVID-19. So this led many physicians to question their eligibility. Now, HHS has updated its website to indicate that this tranche of money was indeed intended to help both providers who are treating COVID-19 patients and providers who are struggling to keep their doors open due to healthy patients delaying care and canceling elective services. HHS states that if you ceased operation as a result of the COVID-19 pandemic, you are still eligible to receive funds so long as you provided diagnosis, testing, or care for individuals with possible or actual cases of COVID-19. They note that care provided under this program does not have to be specific to treating COVID-19, and HHS broadly views every patient as a possible case of COVID-19. So we hope that that will clear things up. Again, if you want to read that new information and see it, it's available on HHS's website, which we link to in our fact sheet that's available on our website. But also it's hhs.gov/provider-relief/indebts.html. I didn't get to choose the URL, so I'm sorry for that. But the information is now reflected on HHS's website to indicate that these funds are available to a broader swath of providers than some may have initially thought. And so we consider that to be welcome news, a welcome update. Now, in addition to that, I want to note that we still have some concerns as an FMA about the terms and conditions. Specifically, they include a prohibition on balance billing or surprise medical billing, as it's now being called. And that language is less than clear in terms of, precisely what's prohibited and precisely what isn't. There are also some other aspects of the terms and conditions that we consider to be ambiguous. And we certainly encourage any and all physicians who are concerned about those to read them in detail and to be aware that we are working as hard as we can through our collaboration with other medical societies and the AMA to seek additional clarification on those terms and conditions. Another thing that comes up a lot is some physicians have said, the money hasn't hit my account yet, and that's disconcerting. And so as you may recall, United Health Group or United Healthcare, as it's more commonly known, is administering these funds, these payments. And physicians who believe that they should have received the funds or don't know where their funds are, may call United Health Group's provider relations at 866-569-3522. And again, that information is also available on our website, but I want to repeat it again. United Health Group may be reached at 866-569-3522, and they should be able to give you a breakdown of where your money is at, as well as answer questions about the program in general as you're reviewing it. Finally, I want to mention that HHS has officially released the attestation form as of yesterday that you need to submit within 30 days of receiving the funds. That form is now available. This is essentially the process by which you agree to the terms and conditions. So something else, that's already been talked about that I won't get into again is that the $349 billion allocated for the Paycheck Protection Program is officially run dry. So, of course, we continue to advocate for additional funding for that program there, as we know that that's also very important. In general, the main reason, of course, we're talking about all these payment issues here is because we understand just how hard physician practices have been hit as a result of COVID-19. We've been gathering survey data from our own members just to try to drive this home to lawmakers and make them understand how the practice of medicine is being affected. I have some preliminary results from our survey. Now, these, mind you, are based on just the first few hundred responses. So these data points may change over time as we receive more responses. But what we've heard from our members so far is that 53% have already applied for loans, 42% have already laid off staff, close to 4% claim that they have permanently closed as a result of this, and 64% say that they have adopted or expanded the use of telemedicine, and 25% say they have temporarily closed. And there are many more physicians who are considering all of these actions. And so as a result of this, we know that, COVID-19 has had a nasty and extraordinarily unfortunate impact on the practice of medicine and on access to care for patients. And our survey data is at first it's stunning, but it's also sadly consistent with what we're seeing from the MGMA's survey, which found that 97% of practices have experienced some kind of negative financial impact, directly or indirectly, as a result of COVID-19. And on average, according to the MGMA, practices report a 55% decrease in revenue and a 60% decrease in patient volume since the beginning of the crisis. Those last couple data points came from a survey that was conducted by the MGMA about a week ago. So now the next question is, what are we doing going forward? What types of things are we advocating for going forward as future legislation is considered? Keeping in mind all of the uncertainty that Erika mentioned with respect to what Congress will or actually won't do as they consider a phase 4, phase 5, phase 3, 2.0, et cetera. And to that end, the FMA signed on to a letter with more than 100 other medical societies, including the American Medical Association, asking for Congress to take several additional actions. And so I'll just give you an overview of a few of the things that were in that letter. That full letter may also be found on our website, and in addition to that, on our social media feed at Florida Medical Association on Twitter and Facebook, et cetera. So one thing that we're asking for is for those Medicare accelerated and advanced payments that you've already heard about to basically for some improvements to that program. We would like to see the basically the recoupment and repayment period increased for physicians who receive accelerated payments under the Medicare payment program. As many of you know, after 120 days, you're going to start to see recoupments towards Medicare advance payments, and those Medicare advance payments have to be repaid currently within 210 days for physicians generally. And we'd like to see that extended to 365 days, a full year, that is, of course. And we'd also, of course, like HHS to have authorization to provide more of these types of advance payments. And there's some other policy details there as well, but I won't cover everything in full. The letter gets into more detail. Around Medicare and Medicaid, we also are advocating very strongly that Medicaid rates be temporarily increased to Medicare levels for the duration of the public health emergency. And we are also asking that budget neutrality be waived for any updates or changes to RVU values under the Medicare physician fee schedule in 2021. As some of you may be aware, in 2021, CMS has proposed several rather substantial changes to valuations of various services under the Medicare physician fee schedule, and we would hope that we would be able to acquire some sort of waiver on the budget neutrality provisions were those changes to be implemented. Additionally, we would like to see an extension of the sequestration relief that's been provided to extend all the way through the end of next year so that physicians have a little bit more financial certainty at these times. Perhaps most importantly, we're asking for more direct financial relief for physicians. I mentioned an extension of the Paycheck Protection Program is something obviously we're absolutely advocating for. And we'd also like to see a specific set aside in some future piece of legislation. There was a amendment that unfortunately was not adopted to the CARES Act by Senators Bennett of Colorado and Barrasso of Wyoming that would have provided an emergency one-time grant for all providers and ambulatory surgery centers equal to total payroll from January 1st through April 1st of 2019. That would, of course, been tremendously helpful to physicians, and that relief and similar types of relief are something we'll continue to strongly advocate for. There are several other things in this letter. I'm not going to cover everything, but one other thing I wanted to mention that I know is near and dear to many of you is with respect to telehealth. That CMS Medicare for the fee-for-service program has dramatically expanded the availability of telehealth services for physicians, and this is a huge deal. Many of those changes are very, very welcome, but there's still some things that are needed. We need to occur that may require some statutory changes. For example, we want to make sure ERISA plans, that is self-funded plans from large employers, are not exempt from state regulations around telehealth requirements, and that in fact we would prefer that Congress go ahead and require that all health insurers pay for telehealth services and telephonic services at an equal level of generosity at parity rates for in-person services, and to cover all of the same types of services that Medicare will be covering for the duration of the pandemic. we believe that that is a crucial policy, and that's something that we're fighting for as well. And, in addition to that, I want to note that we know that there are still some questions around telehealth billing, and that there's still, a lot of people trying to figure that out. And so in a future webinar, I just want to note that we're hoping to bring in some coding and billing experts to answer all your questions and go into detail about how to bill for various types of telehealth services, and to most effectively take advantage of some of the policy changes that have occurred. So again, there are numerous other changes to the law that we support as well, including additional malpractice liability protection for physicians. And again, if you want to go to our website or to our social media feed, you can see the letter that we sent in full. But rest assured, we're doing everything that we can to advocate for you during this crisis, and we want to serve you in any way. So again, this was just an overview of some changes that we would like to see in the future. Again, just enhance the amount of support that's available to physicians, because while Congress has taken some steps that we feel are very much in the right direction, we believe that a great deal more is needed in order to help our members practice medicine. And with that, I'll close. Thank you so much again, Dr. Giffler, and to all the people who took the time out of their day to be here.
Thank you, Jared. While we've been focusing on federal programs, a number of those issues as far as telemedicine payment, liability, relief, etc. We've also been corresponding with our state government, including and especially our governor. You want to briefly comment on those efforts, and then we'll go to questions. We have quite a few questions.
Yes, sir. You also be rest assured that we're pushing for the Office of Insurance Regulation to expand the requirement around telehealth to ensure that all commercially insured plans that are licensed in Florida provide telehealth services at parity levels, at a level of generosity at least equal to that of the Medicare program. Unfortunately, as of this time, the OIR has not, mandated that insurance companies do so. Jeff Scott, our general counsel, can talk a little more in detail about some of the ongoing changes, or some of the ongoing discussions rather that we're having to try and effectuate that change. But that is something that's ongoing, that we strongly support, that we're strongly advocating for, that we haven't seen yet, but that we hope that we can ultimately achieve, because we understand how important that is. And Jeff would also be a better resource than I, but just to let you know, we are also advocating at the state level for medical malpractice liability waivers for physicians as they treat patients during this pandemic as well, because we understand that currently that environment is still something that is hugely problematic, and many physicians have a serious and I think, frankly, unprecedented concerns regarding medical malpractice in this environment. And to that end, I also want to note that for another future webinar as well, we're working very closely to get experts from the Doctors Company, one of the largest medical malpractice carriers in the state, to come here and provide a full explanation and overview from the perspective of such experts on the medical malpractice liability environment here in Florida. And if there were specific questions regarding our state efforts to address the situation with the health plans here in Florida, or medical malpractice liability here in Florida, Jeff would be a better person than I would to go into any sort of questions that people may have. But I absolutely agree that those are important issues as well. And again, thank you.
Thank you. We have a number of questions. Some of them were already answered by the presentation, so I will abbreviate, and so we can get as many answers as we can. First one that strikes me as very significant. We talked about the $30 billion grants for Medicare providers, and one of our pediatricians wants to know, what about Medicaid providers? Is there anything in the works for that aspect of the program?
Yeah.
Hey, no, go ahead, Erika. You
Okay.
probably have better intel than I do.
Yes, so it's a great question, and I think that HHS is very aware that the first tranche of the $30 billion was probably not the best way to allocate that, but they needed to get the money out the door quickly, and the only way to do that was with the data that they had. I'm not making excuses. I'm simply telling you what they have told everyone else, because they've received quite an earful about it. But they fully acknowledge that serving the Medicaid population needs to be addressed and recognized, and of course valued. So during the next $70 billion, like I talked about earlier, part of getting that $70 billion out, a portion of that will go to Medicaid providers. Now, how they set that and what it's based off of, I'm assuming it's based off of some sort of Medicaid data that they currently have, but it took longer to get and to sort of weed through than their Medicare fee-for-service data. But a portion of that $70 billion will be getting out the door either today or next week. But I would think it's coming ASAP. But Medicaid providers will not be left in the dark.
Here's another good question on the payroll protection program. If an employee of their own will either quits or is retiring, do they need to be replaced in order to qualify for the loan forgiveness?
This is Michael with Carr, Riggs and Ingram. There's not a whole lot of guidance on the definition of full-time employees. If they're hourly, I'm assuming that there would be some kind of calculation to get an average number of full-time employees based on the hours that were worked. But the essence of the program is that you retain the same number of full-time employees to get the full non-reduced value of your forgiveness. So I would say that you need to probably replace that employee in order to not have the forgiveness reduced in any way.
Okay. Here's another question. Are employee retention and employee sick leave payments, are they forgiven or do they need to be paid back?
This is David White with CRI. No, the credits would be, you would pay the employee and you would get a credit as a reduction in your payroll taxes that you would pay throughout the month. So you would pay them and then you would get a reduction in your credit, a reduction in your payroll taxes as a credit. And so you would not have to pay that back. No.
Now, could you qualify if someone elects the withholding deferment for the payroll, what programs can they not participate in or are mutually exclusive with that program?
As far there in general, and this goes back to one of the common themes that there has been, we are awaiting continued guidance to come out from the Treasury and the SBA in terms of exactly how some of these elements work. But in general, the spirit is there is no allowance for double dipping. So you can't get a credit for one set of payroll and then also have it be allowed to be forgiven in another. And so there will be some calculation where you will have to weigh whether or not to have payroll be considered forgiven versus have it be considered an element of potential forgiveness or a reduction in terms of if you were an affected industry where you are actually your business has been affected by more than 50% of sales to where you can actually have a retention credit. So there will be some analysis that's done. It won't be just a blanket one size fits all answer for everyone. There will be some weighing of options depending on what your situation is.
Thank you. Jared, you may have mentioned this, but the specific question, what is going to happen with MIPS and MACRA for this year and next?
Hey, that's a great question. So in 2019, so let me answer that because this year and next year could mean different things. So CMS, has qualified that, they're still evaluating their options for the 2020 program year for the merit-based incentive payment system. But for 2019, they did delay the data submission date, and they did provide an option for people to basically submit a extreme and uncontrollable circumstances application that would basically allow them to receive a neutral payment update rather than submitting data and being judged on the data they submitted for the 2019 program year. We actually have a fact sheet on our website that goes into all the detail here, but the main thing to know is that for right now, for 2019, for those of you that are still contemplating whether or not you would submit data to the MIPS program, they have, given providers the option under that 2019 program year to essentially, take a pass and rather than being judged on their data submission, qualify under what they would call an extreme and uncontrollable circumstances program and receive a quote neutral payment adjustment, which is just a fancy way of saying you wouldn't be penalized or receive a bonus. And for 2020, we're still awaiting guidance. When CMS says they're evaluating their options for 2020, my hope would be that ultimately they will provide similar relief for 2020, but we'll have to kind of wait and see on that end.
I have a question here submitted. Maybe this is an answer for any of our panelists, particularly maybe Erika. The Medicaid monies to be distributed. How does this affect states like Florida that have primarily Medicaid managed care and it's commercial carriers that are holding the dollars and not the government that we get?
Yeah, I mean, I think that this is part of the difficulty that HHS originally ran into is how to address these discrepancies between states. And, Medicaid is always a food fight between different states because there are a disproportionate number of states that have a much higher rate of Medicaid authorization and utilization, Florida being one of them, New York being another, so on and so forth. So I don't know how they're going to handle it, and I wish I had an answer for you, but I don't. But I can tell you if HHS screws it up, FMA will probably be one of many that tells them how to do it better in the future, which I know probably doesn't give you, great fanfare to begin with, but, that's what CMS is currently working out.
We have some questions here that are getting quite wordy. One question wants to know, one of these forms requiring a question regarding the cost of goods and services for independent contractors. Any advice on how to complete that?
Hey, Michael, do you want to tackle that one?
I'm not sure exactly the full extent of the question there with cost of goods sold and services for an independent contractor. I can tell you that if it relates to the Paycheck Protection Program, the guidance that was issued this week points directly to the Schedule C on your 1040 for 2019. So basically, whatever the net profit is, that would be your amount of the proceeds, and we're assuming that that would be basically the same formula that would go into the forgiveness. If there is a reduction from your 2019 level in 2020 on your net profit, you could also include some of the business expenses that would normally be included on your Schedule C, such as the rent and utilities, payroll, benefits, that kind of thing. So the guidance on it has been pretty loose. But that's the idea, is that whatever would be on your Schedule C from 2019 would generally be the loan proceeds and also forgiven if at the same level.
We have a question here that's a bit lab specific, and I'm not sure if anyone knows the answer. Feel free to chime in, but the question is, please comment on when clear restrictions on finger stick immunoglobulin testing will be relaxed and physicians will be able to do that in their office.
Dr. Giffler, I'll take that one. This is Jeff Scott, the FMA General Counsel. The FMA has reached out to the Agency for Healthcare Administration. They administer the CLIA program in Florida. We've asked for information on this subject. We were informed that these tests are non-wave tests of high complexity, and that to be able to do them in a physician's office, you have to have a CLIA certificate. We've approached the Secretary. We've requested that Secretary Mayhew waive this requirement, waive enforcement of this. There's a bit of consternation over whether this is, it's obviously clear as a federal program. The key is how much enforcement authority does the state have over this particular aspect of it. And so we're attempting to work it out with ACA to allow physicians to do this in their office. We have not heard back from the Secretary as of yet, but we are still working on it. So I don't have an answer for you right now, but it's something the FMA is working on.
Well, good luck. As you recall, ARCA used to license and regulate our state laboratories, and a couple of years ago they decided to basically discontinue that and defer all this to the federal government and the CLIA program. So that makes your task challenging. Good luck. I hope we get some relief there. We have a few questions left. Unfortunately, I got called for another urgent consultation here on this subject. There's a few questions left. I think most of them have been partly at least answered, but Matt, do you want to take over moderating this? We don't want to leave any questions unanswered that we have this panel assembled right now. And for my own part, I hope you've enjoyed the information you've gotten. Unfortunately, we probably will have to reconvene this meeting again sometime in the future to update you, as so many of these issues are constantly changing and being developed. So thank you all very much, but please continue.
Yeah, I think the next question is, we've gotten a couple more on the HHS stimulus funds being considered taxable income. I know you all addressed that a little bit earlier, but can you take a little deeper dive there? I think that would be our Carr Regs colleague.
Brian, are you on the line? Would you be available to address that one?
Hey guys, I'm here. I'm in a bit of a dead spot, but I can do my best.
All right, Brian, the question is HHS stimulus funds considered taxable income for our practice?
Very good question. And I've heard that same question many times. As of now, there's much in the way of guidance out there on it. I can tell you that we are advising our clients to plan as if it is taxable and hope that it's not. I know there's no appetite out there for it to be taxable. But at this point, I would just contingency plan that it's going to be, and just be pleased if it's not. And I know that's not the answer that anybody wants, but I would say also that if you're not aware, the IRS essentially doesn't exist right now. They've furloughed everyone and have gone home. It's almost impossible to get a hold of them. So we're expecting more guidance from them on that when they get back online, hopefully next month.
Okay, and this question may also be for y'all. We have multiple employees. We can stagger their work weeks. Any suggestions for maximizing PPP eligibility without losing credit for time at home for childcare?
I think this is Michael. Again, that relates to the calculation of full-time employee, and it's going to be tough. If they're hourly employees, there's going to have to be some kind of average full-time employee calculation that comes into it. If they're salaried employees, if they're taking time off and coming back, I think that's going to probably boil down to, do you want to retain those employees over that time period and pay them while they're gone? If that's the case, then you are retaining that workforce and those full-time employees over that 8-week period. So your reduction of the forgiveness as it relates to the formula of retaining those employees should be maintained. Again, we sound like we're deferring a lot of the questions, but the guidelines are just not very specific on specifically the calculation of full-time employees.
All right, next couple of questions are for Jeff, I believe. First one is, how long physicians can prescribe controlled substances through telemedicine, and can controlled substances be prescribed to new patients when using telemedicine?
Yeah, the there was an order, emergency order 20-002 that went into effect in March that would allow physicians to prescribe controlled substances for chronic non-malignant pain to existing patients via telemedicine without having to conduct an in-person visit. That order expired on Wednesday, but was immediately renewed, and it will be in effect until May 8th. The DEA has relaxed the prohibition on the in-person medical evaluation requirement for controlled substances. So for federal purposes, you can do that. But Florida law still is in effect, and there's a prohibition on prescribing controlled substances through telehealth for anything other than the treatment of a psychiatric disorder, inpatient treatment at a hospital, treatment of a patient receiving hospice services, or the treatment of a resident at a nursing home. So unless you are providing a controlled substance for chronic non-malignant pain, you have to do it for one of those four categories to be able to do it through telehealth.
All right, Jeff, and one more for you. Is there any movement for reduction in medical liability insurance premiums for physicians who have had to dramatically reduce their caseloads, such as surgical specialists?
Yes, there has been, and I know specifically that the doctor's company is willing to take a look at that on an individual basis. So if you have experienced a reduction in your workload, contact your agent at TDC or any other insurance company that you may be with, and try to work that out. They are making allowances on an individualized basis.
Okay, thank you. We just have a few more. Does the FMA have any idea of how many doctors received PPP funds, even anecdotally? Jared, maybe for you?
No, is the honest answer to that. The data that I have seen is not nearly granular enough to get to that. So unfortunately, I can't give a specific answer.
Okay. And then it looks like it's 1 o'clock right now, so we're going to go on and be respectful of everybody's time. Anybody that did not get a question answered or still has questions, please email those questions to membership@flmedical.org. That is membership@flmedical.org, and we will get those to the appropriate panelists for you and get those answered. We will be doing another call next week. We are working on that one to be specifically about the medical malpractice environment in COVID, as well as a regulatory update from Jared, and Erika will be back on for some DC updates. Thank you, everybody, for attending. Thank you to our panelists, and hopefully everybody will come back next week. Thank you.
Thank you so much.